Hi, I'm Rakia. This infection prevention and control education series is produced under the guidance of the Taiwan Medical Mission. Today's topic is personal protective equipment. Personal protective equipment, PPE, includes clothing and accessories worn to minimize exposure to hazards that cause infections or illnesses. In healthcare, it plays a crucial role in protecting both healthcare workers and patients from the spread of pathogens. PPE means personal protective equipment. It protects healthcare workers from infection. It works like a barrier between the body and germs. Examples are gloves, gowns, masks, and goggles. Infection prevention and control, or IPC, is very important in reducing hospital infections. PPE helps protect us by acting as a barrier between germs in our body. When we use PPE correctly, it keeps both healthcare workers and patients safe. PPE means personal protective equipment. It is special clothing or tools that protect people from infection. In hospitals, PPE helps stop the spread of germs and keeps everyone safe. This picture shows the parts of a PPE kit. It includes a hood cap, face mask, coverall suit, apron, gloves, and shoe covers. Each part helps protect different areas of the body from infection. PPE use depends on the level of risk and the type of precautions required. We usually follow two main principles: standard precautions and transmission-based precautions. Standard precautions mean we protect ourselves every time we might be exposed to blood, body fluids, or secretions, even if we don't know whether the patient is infected. Then, we have transmission-based precautions, which depend on how the disease spreads. For contact precautions, like with MRSA, we wear gloves and a gown. For droplet precautions, such as influenza, we wear a surgical mask. For airborne precautions, such as tuberculosis, we use an N95 respirator. So, when you think about PPE, remember it's not one size fits all. The right PPE depends on how infection spreads and what kind of exposure you face. Now let's talk about how to wear PPE properly, also called donning. The goal is to make sure every part of your body is well protected before you care for patients. Step 1. Perform hand hygiene. Always start with clean hands to avoid contaminating your PPE. Step 2. Put on the gown and tie it securely at the neck and waist. Make sure it covers your body fully. Step 3. Put on your mask or respirator and adjust it to fit tightly over your nose and mouth. For N95 respirators, always perform a seal check. Step 4. Put on goggles or a face shield to protect your eyes and face. Step 5. Finally, put on gloves, making sure the cuffs cover the sleeves of your gown. Once you have all PPE on, you're ready for safe patient care. You can refer to this next image. It shows the full donning sequence visually. Here you can see the full sequence for putting on PPE. It starts from wearing scrubs and shoe covers, then hand hygiene, mask, cap, goggles, and gown, finally finishing with gloves. The important thing is to follow this order every time and make sure each step is done carefully. Remember, small details make a big difference in protection. After using PPE, the most important part is taking it off safely. Remember, the outside of your PPE is contaminated, so every step must be slow and careful. Step 1. Remove gloves. Gloves are usually the most contaminated. Grasp the outside edge of one glove and peel it off, then hold it in the gloved hand. Slide an ungloved finger under the wrist of the remaining glove and peel it off over the first one. Dispose of them safely. Step 2. Remove the gown. Untie the gown carefully, touching only the inside. Pull it away from your body and turn it inside out before discarding. Step 3. Perform hand hygiene. Even after removing gloves and gown, always clean your hands before touching your face or other equipment. Step 4. Remove your face shield or goggles. Take them off from the back or the side, avoiding the front surface. Step 5. Remove your mask or respirator. Do not touch the front part. Remove it by the straps only. Step 6. Perform hand hygiene again. This final step is critical. Clean your hands one last time after removing all PPE. Always remember, correct doffing is just as important as correct donning. The goal is simple: protect yourself from contamination after caring for your patient. So now let's take a look at how to remove the gown properly. Remember, only touch the inside of the gown. You can see here, first untie the straps, then pull it away slowly and roll it inside out before disposal. Now that we've learned how to wear and remove PPE, let's look at some common mistakes we often see in practice and how to avoid them. First, touching your face or adjusting PPE while using it. Once your gloves or gown are contaminated, touching your face could transfer germs directly to yourself. So, after you put on PPE, avoid touching or adjusting it unless absolutely necessary. Second, not changing PPE between patients. Remember, PPE is single-use. Using the same gloves or gown between patients can easily spread infection from one to another. Third, improper hand hygiene. Hand hygiene must be done before putting on PPE, after removing PPE, and anytime you suspect contamination. And lastly, the wrong donning or doffing sequence. Skipping or reversing steps can lead to self-contamination. Always follow the correct order we just reviewed. If we can avoid these simple mistakes, PPE will truly protect both us and our patients. After using PPE, proper disposal is just as important as wearing it correctly. First, single-use PPE, such as gloves, masks, and gowns, must always be thrown into the appropriate infectious waste containers. Never mix them with regular trash. Second, if the PPE is reusable, for example goggles or face shields, they must be properly decontaminated following your hospital's guidelines before being used again. Third, sharps like needles or scalpel should always be placed in puncture-proof containers to avoid injuries. And most importantly, never reuse single-use PPE. Once it's contaminated, reusing it increases the risk of infection for both staff and patients. Safe disposal is the final step of infection prevention. It protects not only you, but also the cleaning and waste management staff who handle these materials after you. Let me share a short case with you, a real example of how PPE can truly make a difference. During the COVID-19 pandemic, one hospital ward followed strict PPE protocols. Every staff member, doctors, nurses, and cleaners wore the correct PPE every single time, followed the right sequence, and practiced hand hygiene carefully. Over a period of 3 months, even though many COVID patients were admitted and the workload was very heavy, not a single healthcare worker was infected. This case clearly shows that PPE really works, but only when it is used correctly, every time by everyone. So, when we follow the right procedure, we're not just protecting ourselves, we're protecting our patients, our colleagues, and our families. As we come to the end of this session, remember this: PPE is not just equipment, it is your shield against infection. Always wear the right PPE for the situation. Put it on and take it off in the correct order, and never forget hand hygiene before and after use. Proper PPE use keeps you, your colleagues, and your patients safe. Infection prevention truly begins with each of us. So let's make safety a habit, because safety starts with you. PPE is your shield. Wear it right every time to protect yourself, your patients, and your team. Practice and good training are the best ways to prevent infection. Thank you for doing your part to keep patients safe. If you liked our video, don't forget to give it a thumbs up and share it with your colleagues. We'll keep posting more helpful infection control tips. Stay tuned and stay safe.